afternoon, evening, everyone. Here we are, come to the last session of these 3 days of fantastic discussions, amazing learning, amazing exchange of ideas. Uh, there were so many rich ideas and topics discussed over these 3 days through diverse set of speakers, diverse set of subjects. Uh, Only fair that we have both of our co-chairs, Julie and Janak, uh, give their closing comments around what are some of the key things that we learned and what are some of the thoughts that we should leave with as we conclude these 3 days. Over to you, Julie and Janak.
Janak, are we going to fight for who gets to go first here?
No, please go ahead, please.
Okay, great. Well, first of all, it's been a great 3 days to spend time with everyone here and the esteemed group that we have. Some of my recaps have been really talking about the session topics that I was focused on and that I was assigned, which are using improving health outcomes with using real-world evidence to engage patients. Some of those involve India to serve global healthcare, and some of those with clinical and medical, and also talking about how we would use this in real world data for clinical trials. So some of the really interesting pieces I thought were accessing and curating the relevant patient information. We were able to bring together a multidisciplinary team by collaborating how the different data providers can address care gaps. We talked about bridging the gap between clinical research and real world practice. We talked about diverse patient outcomes and populations in literally every single size of whether it was the ecosystem that serves global healthcare. But then we also talked about kind of the real world data trifecta of data quality, fit for use, and using AI. So I think most of the pieces that I took away, we're going to be posting also as publications to be able to see and reference back, because I think these sessions were just so jam-packed with so much information and modeling that we can use. Also want to thank all of our speakers for demo day. They were able to show pieces of what was happening around the world and actually show a real life practical example of what's happening. Probably two of my favorite things are we had so many different aha moments that happened when we talked about quality of data and when we talked about the completeness and how do we walk. We now know that the X-ray can identify race, sometimes ethnicity as well, but race. So we've been able to kind of have our own eyes opened at things that we thought were still, a few weeks, months, years away, and they're happening today. So I have some other thoughts, but I want to give some of the stage here over to Janak to, first of all, the X-ray and some of the other, technological advances that you're using and also taking back to your work on Monday.
Fantastic. Thank you. Thank you, Julie. So first of all, I wanted to say big thanks to all the speakers. And as I've indicated before, this is the first time a truly global audience in the real world evidence space has come together to talk about practical items. We didn't talk about strategy. We didn't use a lot of big words. We actually talked about what's practically applicable to you when you go to work on a Monday morning. What are the things and the questions you're going to change? What are some of the artifacts that you're going to influence if you're writing an RFP? What are the questions you're going to ask your vendors? So with that note, I would say, I wanted to summarize a few kind of key points. We talked a lot about medical decision-making and evidence-based decision-making in Saudi Arabia. Saudi Arabia is a huge partner in the RWE space, not just because of the statistical relevance of the size of the population there, but because they have taken key initiatives like Rakim and the genetic testing programs and highlighting, the MOH's role in integrating data and the patient outcomes, not just on the care provider side, but also in drug development, in manufacturing, in decision-making, and in healthcare IT initiatives. So it's really important that we include the Saudi Arabian country and the whole continent, including UAE, as a part of the broader initiatives. Many of my friends and former customers and business partners from UAE are directly involved in many of these initiatives between Dubai, Abu Dhabi, Sharjah, Jeddah, etc. We also talked about industry trends in real-world evidence. And some of the most important trends, I would say, is the relevancy and the operational effectiveness post-tokenization, which means you can access the data, you can tokenize the data. What happens after you tokenize it? It becomes a very, very important argument from cost economics and utility and usability perspective. So really think hard about it when you go back to the desk. We are also talking about how these regulatory submissions will require different aspects, traceability and audit trails, from consents to quality to relevancy to effectiveness associated with workflow data, calibration data, etc. when you're buying RWE data sets. So buying real world evidence data sets, especially when you go to novel data sets like pathology, like imaging, like mRNA, like genetics, it's very important to articulate when this data was generated, not just where the data came from, and when is directly relevant to the workflow within a clinical setting. And lastly, I would say, the future advancements in, multimodal data sets is very important, because if an average pharma company today an average mid-sized pharma company today has over 200 sources of data. Rationalizing 200 sources of data, inventorying it, and defending the budget to continuing to spend on so many data sets in a meaningful way is where a lot of the questions are going to be in the future, which means that how do you demonstrate clinical utility, outcomes utility, evidence utility, and accelerated cost efficiencies for filing, submissions, etc., from your data assets. So those aspects become very important internal discussions as a sponsor, as a CRO, and even as a data company. Because if you're a buyer of data, the future is not going to be, I need my 300th source of data. The question is going to be, is it really elevating the quality and maturity of the questions I'm asking? And at the end of the day, is it really accelerating my filing and submission process and making the quality of the hypotheses better from an effectiveness perspective, safety perspective, and what have you? So with that, I would say thank you for 3 days of one of the most exciting, invigorating, and energetic conferences I've been a part of, and I'll hand it over to Purav.
Thank you. Thank you so much, Julie and Janak, for all your comments, all your support in this entire journey, from the concept to the execution of this entire event. Would also like to take this opportunity to thank all the 50 plus speakers who came and addressed our audience over the last 3 days. People across the world, across time zones, across different stakeholder areas took their time, shared their insights with open hearts and minds. Over last 3 days, we had 1,180 participants who have attended this event, taken their time to learn, exchange ideas, and the event would not have been successful without them. So big thank you to all the participants. This is the first time we are ever doing this. Medflix team and all other partners, they've been a real supporter in terms of ensuring that we pull together this event. So big thank you to all the partners. And last but not the least, the core team from Healthark, which ran the event from last 5 months. All of them have been seamlessly running day after day, all the background work that went into the event. So big shout out to the Healthark team. It just shows like how far we have come, and I cannot be more proud at this moment. Like all good things, like everything, all good things come to an end, and so is this event. But I would like to say that this is, to me, is not an end. As Healthark, we believe that we have started something here, and this will go on for years to come. This will be a platform where some of the best ideas will not only be exchanged, but will be conceived over time. I'm always motivated by a Chinese proverb, which I heard once when I was young. They say that a candle which is lit forever, and all the darkness in the world cannot extinguish it. I believe same will be the case for the research summit as well. So with that, we'd like to conclude. Thank you, everyone.
Thanks, Purav.